Good morning, good afternoon, good evening. Thank you for joining. Today, we will be discussing building climate resilient and environmentally sustainable health facilities in Africa. I would kindly encourage participants. You can raise your hand either before speaking, and I'll call on people by names so that you are able to join the discussions. And I'll also suggest, if you're given an opportunity to speak, kindly don't take too long, and then we be focused to the topic. And then if you're not speaking, I'll kindly request if you could put your mic on mute purposes, because we want to limit the background noise. And I'll encourage most of you, you can also use the chat box for questions or comments, and also for any reactions. So allow me to kindly share some of the description of the session. We are going to discuss about the design and construction of health facilities. They play a critical role in sustainability, resilience, and patient well-being. This session will examine eco-friendly, patient-centered, and culturally sensitive design innovations, including approaches inspired by indigenous knowledge. By the end of the session, you'll be able to learn about disaster resilience, construction techniques, the use of locally sourced affordable materials, and design choices that enhance both climate resilience and healthcare. Our learning objectives will be, you'll be able to understand the principles and benefits of climate resilient and sustainable health systems, including how healthcare facilities can adapt to climate change. They can adapt to climate change, reduce greenhouse gas emissions, and align with global and national climate change, reduce greenhouse gas emissions, and align with global and national climate priorities. Identify practical solutions and innovations in energy, water, waste management, facility design, and operations that strengthen healthcare delivery while reducing environmental impact and operational costs. Strengthen the capacity of health professionals and stakeholders to plan, implement, and advocate for sustainable climate-resilient health facilities through collaboration, peer-based learning, and access to existing guidance, frameworks, and networks. Today's speakers, we have, first of all, I'd like to say we have been having a webinar series. And this is the fourth webinar whereby we are looking at the innovations and design of construction. Our learning objectives will be to identify features of eco-friendly, patient-centered, and culturally sensitive healthcare facility design, draw inspiration from indigenous knowledge systems in healthcare facility design and construction, evaluate examples of durable, affordable, low-cost, and locally sourced construction materials, apply disaster resilient design principles to new and retrofitted healthcare facilities. Our speakers today, we have Mr. Bilal Ahmed Adu, Healthcare Quality and Sustainability Consultant, Shefa Olmar Hospitals. He will share two practical experiences he's been involved in. One, the lead certified healthcare project in Nigeria, and another sustainability-focused project in Nigeria, focusing on key guiding principles for climate-resilient healthcare design. Two, we have Emery Karenzi and Rin Gazan, Build Health International. They will focus on Guild Health International's work, and they'll select case studies that are aligned with key elements such as eco-friendliness, patient-centeredness, and cultural sensitivity. They will highlight 3 projects in Sierra Leone, Cameroon, and Tanzania. They will also expand on the concept of patient-centered design to include user-friendly spaces that consider both patients and staff experiences. I welcome Mr. Bilal Ahmed Adu to share with us the work he's doing. Welcome on board, Bilal.
Thank you. Share screen. Can you see my screen now?
Yes, we can.
Okay. So, good afternoon, everyone, or good evening, everyone. It's my pleasure to be here today, and I want to thank organizing team, especially Daniel and Tinash and moderator. It's a pleasure to be here today. We are not just talking about building; we are talking about fundamental shift in how we perceive the space where life beings heal and is safe. Our topic is the healing architecture as we navigate an era of unprecedented climate challenge and evolving global health threats. The way we design our healthcare facilities must change. So now we are moving integrates climate resilience, patient safety, and global standard. Now, we must ask ourselves, why does design truly matter in a clinical setting? Answer lies in evidence-based design, or EBD. This isn't just about making a building look modern. No, it's about the proven, measurable correlation between hospital, spatial layout, and its clinical outcomes. To illustrate this, look at the groundbreaking work of Roger Orlik, his 1984 study in Science magazine. It changed everything. He proved that patients with a simple view of nature, just looking at trees through window, recovered 8.5% faster than those facing brick walls. This was the first time we saw clear evidence that the design is, in fact, a clinical intervention. Furthermore, research from the Center for Health Design shows that light is medicine. Patients in sunlight rooms experience like 15% to 21% shorter average length of stay. Whether it's clinical depression or recovery from a heart attack, the environment dedicates the base of healing. Simply put, good design saves time, it saves cost, and most importantly, it saves lives. When we talk about the value of sustainable design, we look at it through the lens of the triple bottom line. This framework ensures that our architecture choice benefits every stakeholder in the building. First, as you can see here, patient safety. Patient safety is the first. A well-designed hospital in an intuitive one, by optimizing layout, we can significantly reduce patient fall, like, for example, patient fall, and minimize medical errors. For instance, by placing supplies in consistent location to reduce cognitive load on clinician. Second, we must prioritize staff well-being. Our healthcare heroes face immense pressure. Design can mitigate this by minimize unnecessary walking distance for nurses, for clinicians, for healthcare professionals. Finally, there is operational efficiency. Sustainability is also a financial strategy. By focusing on lowering life cycle costs through smart energy, water, and waste management, we make sure that the hospital stays financially strong for years to come. Ultimately, these three pillars work together to create a facility that is safe, supportive, and sustainable. Now, let's look at this infographic, which summarizes a critical reality, why hospitals fail during crisis. As you can see on the left, we often witness critical system collapse. It's a start with HVAC system failure, which compromise air quality and infection control. This usually followed by electrical grid interruption and distribution of oxygen distribution, which are the lifeblood of any ICU units. In many cases, we also see flooded technical areas and extreme overcrowding, leading to rapid spread of infection. But if we look at the right side of the screen, we see the why behind these failures. These are the design and constructions issues that we ignore during the planning phase. We are talking about poor structure design, inadequate load calculation, and the selection of weak material that cannot withstand disaster. Furthermore, improper zoning and circulation planning create bottlenecks that prevent efficient evacuation, while construction quality defects act as hidden time bombs. So the takeaway here is profound failure in hospital is rarely clinical. It's infrastructure. When a hospital fails, it's usually not because the doctors aren't capable, but because the building itself has failed to support them. You can see here on this slide the main health issues that arise when a healthcare facility is poorly designed. Each of these issues directly affect either patient, staff, or overall operational efficiency of the hospital. For example, sick building syndrome. Sick building syndrome causes headaches, fatigue, and eye irritation. These symptoms are due to poor indoor quality, inadequate lighting, or improper ventilation. Another example is hospital-acquired infection, like MRSA, methicillin-resistant Staphylococcus aureus, VAV, ventilator-associated pneumonia. So some examples like hospital-acquired infection, these are infections patients get while in the hospital related to poor layout and surface, like in operation room, CSSD. So crowded ward, difficult to clean surface, and lack of proper hand hygiene station increase risk. Respiratory issues. Respiratory problems can arise from mold, high humidity, and poor ventilation. Another disease like musculoskeletal strain. Musculoskeletal strains, staff may develop musculoskeletal strain from poorly designed workstation or patient handling. Mental health impact, stress, and anxiety, and low patient satisfaction occur when there is insufficient daylight, high noise, or non-therapeutic design. Finally, thermal discomfort, heat stress. Patient and the staff experience heat stress in older or non-climate adapted building. So let's go to designing climate resilient and sustainable healthcare facilities. Before start to build new hospital, You need to have climate-informed strategic planning. First, you need to have current site risk profile before start anything. So the first step in any facility planning is to establish a risk baseline. So you need to you need to identify natural hazards. For this facility, for this design, you must categorize local threats. For example, use hydrological maps for floods, seismic data for earthquake, and drought indices for wildfire. Then you need to analyze climate trends. Don't just look at today weather. No, you need to gather at least like 30 years on historical data to create climate chart that show temperature and temperature and trend and shift in weather. Then you need to quantify the risk by using risk matrix. You calculate likelihood, how often will it happen, impact, what is the damage to medical service, then calculated to get risk level. One of the most important steps is planning for the 20 years horizon. So once you have the current data, you must project it into the future. A healthcare building should think at least like 50 years. So we plan in 20 years horizon. Then you need to know model temperature, humidity. You need to calculate the extreme heat days expected in 2046. So this indicate your cooling load requirement. You need to have your design. You need to have your design for adaptation. You need to you choose materials that resist future UV levels, and you need to have your strategic ventilation, like design HVAC systems that can switch between normal mode and high filtration mode, like during pandemic. Finally, you need to integrating indigenous and passive solution. So the final step is to reduce mechanical dependency by learning from indigenous knowledge, like passive cooling instead of oversized AC units. Design the building orientation to catch natural breezes, utilize wind catchers, natural shading, and energy efficiency. So moving to the core of our strategy, design resilient healthcare facilities. In this phase, we translate our risk assessment into architecture and engineering solution. We focus on three main pillars: disaster resilient, knowing your life safety. You must incorporate clear emergency route and evacuation plan. You need to have your readiness to avoid total failure. So we implement redundant system. You need to have your operational continuity. So the ultimate goal is to ensure continuous operation. Then you need to have your climate adaptive features, like passive system. We prioritize natural ventilation to reduce our heavy dependency on HVAC system, which lower both cost and carbon footprint. You need to have your resource management, like rainwater harvesting, clean energy. You need to use renewable energy, material and layout innovation. It's a structure of facility. In this, you need to focus on sustainable sourcing, like should prioritize local sources material. This not only supports the local economy, but significantly reduce carbon footprint of construction. Layout optimization, optimize the building layout, human-centric approach, like culture-sensitive, patient-centered. Principle, we repeat it again: passive survivability, redundancy, water security, integration with local knowledge. Now, that we understand the why and how. Now we are, I would like to uh, navigate a complex ecosystem of international regulation. So I'd like to categorize this into three essential pillars: planning and guidelines, engineering building codes, and sustainability and green standards. So starting with planning, we rely on FGA guidelines to dedicate the fundamental DNA of hospital. So this ensuring that the flow of patient and staff minimize infection risk. We then layer this with the WHO, WHO Safe Hospital Framework, which is our checklist for disaster readiness. Finally, applying evidence-based design. But planning is only as good as engineering. Planning is only as good as engineering that support it. So we adhere strictly to international building codes, IPC, for structural integrity, safety, for structural integrity. Safety, however, is need to have your engineering codes related to safety, like NIFBA, NFPA codes, especially 99 and 101. Finally, ASHRAE standard. You need to have ASHRAE standard. ASHRAE standards 170. It's ensuring the air filtration and ventilation is operating room in operating room meet the highest global standards to prevent airborne pathogens. Finally, we look at our environmental responsibility. For example, through LEED, we manage energy and water efficiency, but we also care about the human environment, which is why we look to the well-building standards to focus on well-being. We are broad to align with global green and healthy hospital GGHH network and JCI standards. There is a JCI standard, specific standard with Geneva Sustainability Institute. Is this standard specific in healthcare for healthcare facilities, green healthcare facilities? Okay. To see how all these global standards and resilience principle work in the real world, I want to take you to a project very close to my heart, Shefa Al Orman Oncology Hospital in Upper Egypt. This isn't just a healthcare facility. It's a flagship for sustainable medicine in Africa and Middle East. It represents a vital mission. We're providing free world-class cancer treatment to underserved communities in Upper Egypt. By being a member of Global Green and Healthy Hospital Network, we prove that we can achieve international excellence even in the most challenging environment. However, to truly appreciate the engineering behind this building, we first need to look at the climate reality of location. When we look at the map, you can see and the right down. When we look at the map, we see why business as usual was never an option for this project. This project, located in the heart of Upper Egypt, this non-profit oncology hospital, okay, however, its location in desert environment present us with extreme stress tests. We are dealing with extreme heat exceeding more than 45 Celsius degree, frequent dust and sandstorm that threaten our air filtration system and intense solar radiation. So in the context, sustainability isn't a luxury, it's a survival strategy. So every design choice we made was direct response to this specific climate risk. ensuring that even in the harshest heat wave, our patient remain in a safe, cool, and sterile environment. So knowing the risk is only half the battle. The real question is how did we solve them? To overcome the harsh desert heat, we implement a multi-layer thermal protection strategy. We focus on skin of the building to minimize heat gain before it even enters the facility. So first, we address the roof. In desert, the roof is the most exposed surface. So we use high performance thermal insulation to act as a shield to reducing the energy needing for cooling. Second, we didn't stop at roof. We applied foam insulation in the wall. This creates a thermal envelope that keeps the cool air inside and the desert heat outside. Finally, we looked our at our window. We used double glazed thermal glasses. This allows natural light to enter, which we know is essential for healing, while blocking the infrared radiation that causes indoor heat gain. Schiffer-Oman beyond protecting the building from heat, we had rethink how we power it. So in location like Luxor, the sun is our greatest challenge, but it's also our greatest resource. So we address this. We installed massive solar panels energy. It's exceeding 1.2 megawatts. One of our strategies to address climate risk is balancing sunlight and heat. So we use natural daylight to benefit patients while controlling the heat. So we call this natural daylight. Research has shown that access to natural light is a critical component of the healing process. So at Sheffield Urman, we maximize natural lighting across many hospital areas and patient rooms. This significantly improves patient comfort and physiological well-being. To achieve this without increasing indoor temperature, we use a combination of architectural design, reflective finishing. We utilize light colored and reflective finishes on our walls and ceiling. And second strategy is strategic architecture. As you can see in these photos, the building form, including the grand sunlight, a trim is designed to welcome the sun in a controlled manner. Finally, we must manage air quality and dust control. In Luxor, frequent desert winds bring high volume of dust and sand, which can affect hospital operation if not managed. So we implement advanced HVAC filtration system, many layers, as you can see in the diagram. Second, we utilize green landscaping and the trees as functional design element by strategically planting native around the facility. We create a natural buffer zone. This green belts serve to vital purpose, dust mitigation and microclimate cooling. Second and last example. So having seen how we address climate resilience in the desert of Luxor, let's travel to our second case study, the African Medical Center of Excellence in Abuja, Nigeria. In Sheffield Urman is our fortress against the desert heat. The AMC is a landmark for specialized world-class healthcare in West Africa. As we can see, the design moves away from the traditional massive hospital. Instead, it instead, it use a modern structure that integrates significant green space directly into the building footprint.
Should you be kindly be winding up kindly?
What?
Your time is almost up.
Okay. I start 10. Okay. Just 2 minutes. So Abuja context present us with a very different set of climate risk than what we saw in Luxor: extreme heat, thermal stress, flooding and water, dust, air and air quality, infrastructure vulnerability. So, to dealing with these issues, for example, energy resilience and thermal comfort, we have optimized our HVAC system with advanced cooling and heat recovery. We also added high performance thermal insulation to the roofing and transition hospital to be 100% LED lighting to minimize internal heat gain and energy consumption. Second, we focus on natural light, optimizing by strategically placing windows and skylight. We maximize daylight. Third, we address the serious risk of flood protection. So we have integrated flood barriers, specialized sump pumps, and advanced drain system to ensure that our technical and clinical areas remain dry and operational during. Finally, we prioritize water stewardship and structural integrity. And most importantly, the entire facility is built in full compliance with international building codes. So we expect it to, in the middle of this year, we will achieve and we will get a LEED certificate silver. Thank you.
Thank you so much,
Thank you.
Bilal.
Thank you.
There is a question on the chat box for you. Maybe you could respond to it, and then I'll be welcoming the next speaker, that is Shefa.
Okay. Thank you.
Mary, sorry. Kindly just respond to the question on the chat box.
Now or at the end of the session?
Maybe could you answer after the session, or are you comfortable? Because I'm seeing it's only one question so far.
What does the hospital engage surrounding to strength crime prisoner facility itself? It should be in the beginning, but if we didn't do it in the beginning, climate risk assessment, we can do it now and try to adding mitigation control measurement and doing adaptive and adoption system in your facility related to climate resilience risk assessment.
Thank you so much.
Okay.
Morning, good evening, good afternoon. Thank you everyone for joining today's session. We are discussing building climate resilient and environmentally sustainable health facilities in Africa. Let me take this opportunity to welcome Emery Karezi, Architect Build Health International. Welcome on board, Mr. Emery Karenzi.
Well, thank you, everybody. We actually wanted to go ahead and present together with my colleague, Rene Gassana. So we're going to be following the sequence that we've planned for to be able to deliver this information. So I want to go ahead and welcome Rene Gassana so that we can start with the first few slides. Thank you.
Okay, thank you so much.
Can,
welcome on
can
board,
allow me to share?
Yes, please. For participants, in case you have any question, kindly make use of you click on the more, you'll find we have a Q&A question whereby you can place your question, or you can even use the chat box, and I'll encourage you to introduce yourselves in the chat box. Thank you, and we are glad to having you on board. Over to you, Emery.
Christine and Daniele, if you can allow us to share our screen, that would be helpful. Thank you.
Daniela, could you kindly assist with sharing?
It just looks like all I need is a permission. I think that would be...
You can try again, please.
Okay, so now. Thank you very much.
All right. Yeah. Thank you, Emily. Good morning and afternoon, everyone. Welcome to today's presentation for BHI team, Innovation in the Design and Construction of Healthcare Facilities. My name is Rene Gassana. I'm an architect with Build Health International, BHI, and as I'm here with my colleague Emily, who actually introduced me, also an architect with BHI. Today, both of us will share with you how innovative design strategies and construction approaches are helping our organization, BHI, to deliver healthcare facilities that are safer and better suited for the needs of the community that we serve. Now, I'm going to start by passing to Emily to talk more about BHI as an organization. Thank you.
Thank you, Renee. Again, my name is Emery Kerenzi. I'm an architect with Build Health International, an organization that improves access to and builds capacity for dignified, affordable, and high-quality healthcare infrastructure in resource-constrained settings around the world. That's the mission that is carried in more than 3 ways, but those three ways are through the projects we work on, the partners we get to partner with across the globe, and the team structure that actually gets to work on those projects and execute them. Last year alone, those 3 aspects were qualified by the following numbers on your screen. 93 projects before the end of 2025 were active, and we managed to create a collaboration with 37 organizations across the globe. And our team was made up of staff from 25 different countries of origin. So today, what we did, just like Bilar was sharing, we basically looked into the 4 topics that were shared at the beginning of this presentation, and then we tried to create them into 2 groups. The first group is comprised of 2 topics: the vernacular inspiration, or learning from indigenous knowledge, and then there is design philosophy. And then the second group, we have material selection, and then the fourth group we have the disaster proof, material selection, disaster proof in the second group. And the first group is going to be me presenting, and the second group is Renee. What we decided to do was to take 3 case scenarios, or 3 case studies that are located in 3 different countries, and we're going to be using those as the projects of focus to be able to break down these topics. So going straight to the first topic, or vernacular intelligence, or vernacular inspiration. When we speak of vernacular intelligence, or drawing the inspiration from indigenous knowledge systems in healthcare facilities design and construction, this allows us to really plan and design projects beyond just clinical planning. This allows us to design projects that really are truly embedded within the communities that they serve. And there is no better case study for this project, for this topic, than the Cameroon Children's Hospital, located in Mutengene, Cameroon, where we've partnered with the African Children's Healthcare Fund in 2024 to plan and bring together a building that is above 22,000 square meters. That project right now, currently as we speak, is at the construction documentation stage. So when we speak of vernacular inspiration, then what do we understand? What we did here was to take every one of these topics and divide and break it down to no less than two pillars. And for vernacular inspiration, we looked into 3 main pillars. Now, these pillars can go beyond 3, but we want to focus on these 3 to be able to stay within the scope of this presentation. The first pillar is environmental atonement, second one being material literacy, and then the third one being social embedment. So when we speak of environmental atonement, what we mean here is that the project has to be aware of its locality. to understand how to take advantage of the opportunities and the challenges of the site, which again ties back to what Bilar was sharing a moment ago. And then another thing that we went ahead and did with this project, to be more specific, was to invite nature or to invite environment past the boundaries of the footprints of the project or the building itself, creating spaces like courtyards, which then end up becoming quite beneficial in terms of the functionality of the space, but also the climate performance, or the way the building deals with the climatic challenges of the area. The second pillar of this topic is the material literacy. This again goes back to some of the items that Bilar was sharing, where we decided to select the materials that are from the local area where the project will be situated, which of course opened more chances for us to collaborate with the local contractors, either through the planning and design, and currently through the development of the construction and then the execution, and hopefully in the future through the maintenance, because who is the best person when it comes down to maintaining an infrastructure than the community? And then the third pillar is the social embeddedness. This is the idea that we need to basically design and plan for a space that goes beyond just the clinical aspect of our infrastructure. And during the partners engagement stage, what we realized was that the traditional practices of the Cameroonian community mentions terms like holistic healing and context understanding, basically pushing the medical practices to take into consideration the social, psychological, and spiritual aspect of the healing process. As a result, our practice started planning beyond clinical itself. So we looked into third spaces, like, as I mentioned above, courtyards, and activated lobbies as family and community spaces, and added the play, learning, and spiritual spaces as spaces that strengthen the healing process, making the unfamiliar familiar, or weaving health and community together and allowing one to promote the other. The second topic of design philosophy basically then asks the questions beyond the research, beyond the conversations with the community, beyond extracting the information and extracting the inputs, learning from the indigenous knowledge and practices. How does this then affect the detailed design, but also the construction process, the execution of the project? So that's where the design philosophy comes into play. Now, Build Health International as a practice has a broader design philosophy that is comprised of different items. And beyond these three items that we're going to be discussing within this topic, we also have items like growth. We have modular planning. We have planning for better operational carbon and embodied carbon, a better passive performance. All these are topics that we get to design for within this one design philosophy. But the ones we want to focus on, and the ones that we're going to be using MCOE, the Maternal Center of Excellence at the Kaidu Government Hospital in Sierra Leone, as a case study for, are the ones about eco-friendly, patient-centered, and culturally sensitive healthcare facility design, which stay in the scope of this presentation. When we were working on these it is more than 5,000 square meters and 120 beds in partnership with partners in health back in 2019, between 2019 and 2026, we basically broke down the design philosophy into 6 aspects, but then we want to focus on 3 of those, which again have a better relationship with this presentation. And those are eco-friendly, culturally sensitive, and user-centered. And the question was, beyond again, beyond research and understanding what the community wants and the partner wants, and beyond defining how you wanted to go about this whole process, then how did we bring that into execution and actually end up with a facility that is as beautiful as the one you have on your screen? With the first pillar of eco-friendly, we looked into trying to make sure that the project, again, was using the local materials, yes. But when it came to creating the microclimate, or the micro ecosystems, we then try to answer, to address a problem that did not only exist in the present, but was also going to affect the past. How do we bring in a way that we can host nature within the perimeter of the project to address the microclimate of here and now, but also plan for the need of the future? So that's how we end up going beyond just providing green gardens, and we provided instead the plant nurseries to replace what can be just a simple green garden, meaning there were small plants that were performing while they were growing, but then after a specific period of time, they were also harvested to go and be planted elsewhere to also spread that performance or biophilia, if I might put it that way. The second pillar is the cultural sensitivity. In this project, we try to make sure that we targeted two main points from our partners. And the first one was to design a facility that focused on the training the next generation of equity-minded clinicians, but also a model of mother and child health center in Sierra Leone that was replicable enough to be able to affect the country and the community that is served. And those were the two main items of the second pillar of the cultural sensitivity. Going to the third pillar of the user-centered, this project MCOE looked into the aspect or the life cycle of an expecting mother all the way to delivery and recovery, labor delivery and recovery. And we try to make sure that we designed the elements within the public spaces that allowed for a better recovery for the resting and enhanced well-being of the mothers. And those elements included spaces like outdoor labor walks and the covered outdoor spaces, especially for the courtyards. Those were the three pillars that we had on the MCOE, and the pillars that really addressed the design philosophy in the best way possible and staying within the scope of this discussion. Thank you very much, and I'll go ahead and give the floor to my colleague Rene to continue with the second group of the topics. Thank you.
Thank you, Emery. Before I go deeper into material selection, this next topic, I would like to briefly highlight the context in which we work. As mentioned earlier, BHI being a non-organization dedicated to strengthening the healthcare through what we do, design and construction of medical healthcare facilities, but with the goal to ensure that even in resource-constrained settings, communities can still access safe and high-quality healthcare infrastructures. As a result, we end up finding ourselves having many projects being implemented in such environment. And it became our duty to respond to some specific contexts of that place where we are going to build in. So because of that, material selection actually becomes one of our major critical design decisions. So at BHI, we typically evaluate building materials based on below criteria shown on these slides. First, we focus on material provenance by making sure we prioritize locally available materials whenever it is possible. Then affordability. By affordability, we have to ensure that we are doing cost-effective solutions without compromising quality, of course, and finishes and building systems that require low or even minimum maintenance over the life cycle of the buildings. I have to mention that we cannot compromise quality, yes, obviously, because they are clinical spaces, but also for BHI, healthcare buildings are more than just physical structures because their spatial qualities contribute a lot. their environment that can directly influence the patient hearing outcomes, the efficiency of the hospital staffs, and actually contribute to the overall resilience of healthcare systems. Then we also select building materials based on constructability of that materials. While we are selecting materials, we ask ourselves whether is this a right material for the local practice we find on the ground. If those materials are actually can be realistically built with local contractors and workers, and if those local people can be able to provide maintenance services later in the life cycle of the building. And lastly, but not least, is the carbon impact of the carbon impact and sustainability by reducing the possible environmental footprint and, of course, improving long-term performance. The next slide shows material in details we used on this Kafika project in Arusha in Tanzania. And on this project, we focused on simple construction techniques using local materials and building services building materials that can provide variety of aesthetic finishes and textures. So where we realized that bricks and stone and terrazzo as primary materials were used to achieve the sustainable path and spiritualize local sourcing and ensure actually the long-term environmental performance. And we're also using materials like wood slats, mostly in non-clinical common spaces. The next last topic on our agenda is application of disaster resilient design in our design principles in our design. So again, Cameroon Children's Hospital is found to be a good example on this topic. I will start again by giving you a little bit of the context. Firstly, our project is located in Mutengene, which is in the west of Cameroon. Even though as a country, the overall seismic hazard for Cameroon is often classified as low, this specific region, as it is surrounding the Mount Cameroon, it found to be seismically active. Thus, this region, of course, has to have notable seismic concern in our design because of that location of being on the foot of actually the Mount Cameroon, which is actually an active volcano. So based on that context, which informed our design decision, and basing on the project nature, its building form, the design keeps continuous and properly detailed structural seismic joint so that the building mass is subdivided into independent structural blocks to reduce that impact of seismic movement. The next slides show another issue, which is also regarding to the site locality and condition that we needed to solve: the rain, water, and stormwater management. Rainwater and stormwater management had to be solved for two things: functionality purposes of the hospital campus, and by the fact that our site is actually located at the lower slope of the base of the hill. So the rain is much. Actually, in Cameroon or Mutengen, it rains a lot. So it was our duty to ensure comfort for everyone and mobility within the campus and achieve proper rainwater and stormwater management design principles. So what we did, we used courtyards and softscape to be integrated within the whole coordination of stormwater drainage system, which is actually reducing the stress of the needs of stormwater management. Another thing, design carefully looked at the proper detailing of the roof water drainage system so that it does not both damage the building or also cause future maintenance issues. Another thing, we used covered corridors and orienting them towards those courtyards and have enough covered walkways and canopies so that the campus can achieve all water circulation and mobility. And last thing that is important is actually use of roof. We use the extended roof overhangs for two things, to both protect the building facade as exterior weathering protection and also provide that need we wanted to provide suitable area for pedestrians. So this is the end of our presentation. Thank you. We will be happy to respond to any questions or comments, or if you have specific information, please contact that email shown on this slide. Thank you so much.
Thank you so much, Rini and Emery. I believe there are some questions for you on the Q&A. We have like one question for Karezi, another one for Rini, and then there's another question maybe both of you will be able to.
Listen, we can hear you. I don't know if I'm the only one, but I lost you for a second.
Yeah. Me too. I lost Dario a bit too.
There are some questions in the chat box. Are you able to hear me?
Now we can hear
Yes,
you.
we can hear now.
Okay, sorry. There are some questions on the chat box, and I believe Bilal has one on the chat box,
Three, I
and
think I
then
see three. Yeah.
then he has two questions on the Q&A.
Yeah.
And then for you and Karezi, I've seen there is one question for each of you, and then there is one that maybe you can respond, either you or Karezi. Maybe if I can give you 5 minutes to respond.
Okay.
Time is not on our side. Thank you.
Okay. So what's first? No?
Just I can.
Yeah, you can.
Okay, Bilal first. Okay. Okay.
On the,
I have three questions. First question, what lesson learned from Sheffield Orman Hospital model can be replicated in Egyptian government and resources considered health facilities across Africa? So the first and is the most important is community engagement. Community engagement is essential. Yes, we are lucky. We are a free hospital for treating cancer patient charity. So we actively involve the community through awareness campaigns. We're going to hotels, clubs, and hospital visitors and patients, and we are doing campaigns related to climate change and sustainability and medical outreach staff. We educate our staff about environmental health and climate-related risk. And also Sheffield Orman not only focus on architecture, no, we have, as I say, we have renewable energy, more than 1.5 mega. It's like 30% of our energy coming from sunlight, solar panels, and we have waste management. Our hospital, we are treating our waste by shredding and sterilization in our hospital. We have some tools and some projects related to reducing water consumption. So for this first question. Second question, in what ways does the hospital engage surrounding communities to strengthen climate resilience beyond the facility itself? So as a free, as I mentioned before, as a free non-profit hospital, we maintain close relationship with our community and local organization. So the hospital organized community outreach and awareness campaign on sustainability. We also work closely with donors and society in Egypt, so who actively support our sustainability initiative. Through this partnership, and donors have helped us implement a key environment project, including solar energy system. Solar energy system, we get it as free from donors because we are charity hospital. So as I say, we have 30% of hospital electricity. In addition, medical waste shredding and sterilization system It's coming to our hospital as free from them. Last question coming from India with regard to cascading hazard in the hospital in Egypt, resilient enough and prepare for cascading and compounding hazard. Okay, engineer Tasher. Okay, so I can say yes because we have we have a national accreditation standard for green hospital, and this standard mandate to conduct comprehensive risk assessment to identify potential climate-related and environmental risk, including extreme heat and floods and infrastructure stress. And based on this assessment, the hospital integrates severe preparedness measures such as climate-sensitive infrastructure design, thermal insulation, and energy efficiency. In addition, our hospital develop emergency and disaster response plan, and it's mandate to be testing annually, doing a drill for disaster, our disaster plan. Thank you.
Christine, if you can help with the questions for BHI people.
Q&A. I can only find Q&A questions. I don't know.
Chat. You can check chat. I didn't. I think maybe chat.
So there is one question to Emery and Renee.
Yes.
So what policy or regulatory challenges arise when integrating vernacular?
Yes.
I think we do understand where the question is headed. There is an issue, of course, with the design standards, health design standards that Bilar was also touching on, and the fact that they make some of these passive designs and the use of local materials and the local knowledge a little bit more limited. Because when it comes to planning for a clinical space, you also start to deal with the infection prevention and control practices that sometimes address the fact that the materials have to be a certain way and they have to perform in a certain way. So that's the reason why we end up with selecting materials that will affect the core of the wall, and they have to perform in a certain way. They have to still, protect the space from humidity. They still have to be able to carry the load and to perform in terms of a fire rating. So all of these things are taken into consideration when we are selecting either the materials and practices. But when it comes down to regulations, you can't say we're going to plan for a space and then say this space is going to be outside the sizes that we're asking for. So what that leaves us with is to say the clinical spaces, for example, in terms of planning, the clinical spaces have to be by code. And then the moment we get into public spaces, then there's a little bit of flexibility, and then we can start to pull in some of the indigenous knowledge and practices and make space for community, for example, like we were seeing in Cameroon Children's Hospital. So both material and planning wise, it's a strategy that we use, but it's a process that we have to be really careful about, because we're designing both for the code and regulations, but also we have to deliver a project that feels familiar and welcoming for the community it serves. So it's a fine line to walk, but it's a process that is doable. I don't know if that answers your question.
I see a lot of question and
we go.
Q&A. There is a lot of question. Just check chat. No, there's a lot of question in Q&A.
Christine, are you there? Are you still there?
I'm still there.
Okay.
What we can do?
Can I?
Sorry?
Should I go ahead and respond to this in Q&A so that we go to the chats
Yes.
together?
Okay.
Christina, I think it's better for you to read so the participants will know the question and
Absolutely.
There is that question of, they were for Dr. Bilal.
Four questions.
How can
Tisho.
schools that integrate hard physical hardening, like reinforced structures and underground utility systems, with the soft resilience of decentralized energy grids that are crucial during both fuel shortages in war and grid failures during extreme heat?
Okay.
And then, okay.
Okay. I can read. Okay, no problem. I think resilient hospital design should combine strong infrastructure with flexible energy system. This means reinforcing a building, protecting critical utilities, and designing facilities to be ready with extreme weather and other distribution. At the same time, hospital should adopt energy, adapt backup energy solutions such as solar power with a backup system and the energy store. Like in my hospital, we don't have energy storage because it's battery. We don't have this. We just working on grid system for electricity. So in Sheffield Urban, we follow integrated approach by combining climate sensitive building design with solar energy panels. As I say, more than 30% of hospital electricity. There is another question. How effective is the use of modular design such as a 3D shaping containers and rapidly scaling resilient and sustainable healthcare infrastructure? Okay. This, such as adapted or 3D shaping containers, can be very effective for rapidly expanding healthcare infrastructure, like in emergency situation or in resources limited, like in crisis and emergency situation or resources limited. Yes, this allow facilities to be deployed quickly, but however, we need these units must include proper insulation and ventilation and energy efficient system, particularly in hot climate. When combined with renewable energy solution like solar panels, solar powers, they can support reliable healthcare service even in remote areas during crisis. I think there's another question.
We have the next question for Renee
Okay.
about the bricks production.
Yes. Yeah, first of all, I have to agree with the question. Actually, the traditional firing of brick is not sustainable. But in East Africa, having a lot of clay, I'm actually from Rwanda and based in Kigali. There are so many initiatives that came to solve that issue where you can actually have bricks that can be produced in a more sustainable way. And that's what we are looking for. It's no longer just any project has to find its own. There are actually viable, available options. But something that maybe was not clear in my presentation is that usually bricks or any filling materials like CMU are used as filling materials, and you have to use also reinforced concrete as main structural bearing materials. And in this project, what we did was actually using brickwork as both wall and road bearing materials. So we were actually cutting a lot of carbon because we are removing concrete almost, let's say 90%. You can never remove concrete in the project. But we were using mainly stone and brickwork as the main structural elements of the projects. And the goal was that we are using those available brickwork in the region. There are too many actually in Arusha, which is in East Africa, and actually we are minimizing the use of concrete. That's how I can respond to that.
Another thing that I can add to what my colleague Rene just said is that when it comes down to embodied carbon, we're not only thinking about, there is a process of how you get the materials, of course. There is how the material is made, but then there is also what it takes to get the alternative options. So if we are looking into, let's say, using a concrete block that is going to be imported from, since this product was in Tanzania, there's going to be imported from, let's say, Uganda or Kenya. Now that embodied carbon is no longer about the firing of the bricks. It's also about the transportation from point A to point B, the site. So that's the reason why when we're talking about the provenance, it matters more that you're balancing. You know, there's materials that I use, and then over time they reduce the operational carbon by giving you the thermal insulation you need, and therefore reducing the energy you need to be able to run your hospitals in terms of mechanical systems, of course. And that balance, the embodied carbon and the operational carbon numbers, they start balancing each other, making your building more sustainable over time. So it's not only about that one unit, but it's about how the whole system works in general. So for this project, it was quite passive and it helped a lot.
Yeah, maybe last thing that I can add is the finishing itself. Usually when you're using stucco on top of CME walls, you're also adding some paint, maintenance, and all other things that contribute to carbon footprint of the building. So the goal here was to use our creativity of actually finding various aesthetic textures as a finishing materials, and brickwork does not need more like much of maintenance. That's another point that actually was considered.
And thank you so much. I'd like to take this opportunity to thank everyone for your contributions today. We appreciate your participation and we thank you so much. Have a good rest of the day, evening. Bye-bye.
Thank you.
Thank you. Thank you for your time,
Thank you.
attention.